So we had to ask ourselves, when we realized what community engagement could do, we needed to figure out what our use case scenario was for that. And what's sort of interesting is, as we've moved through this process of rolling out community engagement, and we're still in the process of rolling this out right now, is that some of the stakeholders that we thought that we wanted to notify actually didn't work out, but we also found some unique use cases that we didn't originally anticipate using community engagement for, and we found that that actually works really well for us. So primarily because of our open campus, we have community stakeholders. These are the individuals who work on our central campus but are not our employees. We also have vendors and contractors because we are a very large healthcare facility. We have trucks and supplies coming here every single day, and many of those vendors actually deliver some of those things or maintain the equipment and supplies on our campus on a daily basis. These are people that we simply just can't enroll in our Everbridge notification system because we don't want to maintain the IT component on that. In addition to that, and there was some, to be honest, there were some cost elements to that. So most of you who are Everbridge customers know that with any mass notification system, the cost of your contract is contingent on the number of contacts that you have in your system. And so, if we were to do that, we'd double the cost of our base contract essentially if we wanted to add a lot of these community members to our system. So another unique group that we are targeting with our community engagement tool is the parents or family of students. During previous experiences of disasters or emergencies, we found that a lot of the parents are very anxious about what's happening on our campus or near our campus. One of those examples is the December 2, 2015 terrorist attack in San Bernardino. That occurred approximately 1 to 1.5 miles away from our main campus. And we were receiving a large influx of phone calls, both to our security dispatch center as well as to our administrative offices. People wanting to know what's happening on our campus. Are we under attack? Are our students safe? Are my kids safe? It's really challenging right now because we can't really provide them information about a particular student. So FERPA is federal laws that regulate privacy. This is very similar to HIPAA on the healthcare side. And so if somebody were to call in and say, is Jack Smith safe? He's my son. We can't actually even verify whether Jack Smith is a student within our organization because we're not supposed to release information about our students for privacy considerations. Not to mention, it's very hard to manage an emergency on campus when more than half of your call volume are people just wanting to inquire and get information about the event that's occurring. So we're actually opening up community engagement to the parents. We will be marketing this to them specifically, and we're hoping that they will sign up, and when we have events, we will be actually proactively informing them of the status of the campus, what's happening, and hopefully alleviating some of the load on our Security Control Center dispatch office. There are some special cases that we've identified where community engagement is also an important tool for us. This has to do with our Ronald McDonald house. Again, this is a fairly large residence for patients receiving long-term care within our hospital. Oftentimes these are cancer patients and they're typically pediatric patients. Because the kids and their families are living here, we want to be able to notify them about emergencies or disasters that are happening on our campus. Our foundation for our organization owns many properties throughout this area, throughout the Loma area, and they rent those out to students, to residents, to family members who are here on a short-term or long-term basis, sometimes due to treatment here at our facility. And those are also a target audience for notification with our community engagement tool. And then we also have regular outpatients. These are typically cancer treatment patients or perhaps dialysis patients. These are patients that are here on a weekly basis or even more frequently. And we separated actually our outpatients from our other patient populations, and I'll explain that later when I talk about the non-use. When we were working with Everbridge and reviewing contracts, our client advisor spoke highly of using community engagement for temporary events, and we sort of didn't take that seriously because that wasn't really our use case that we had in mind. But what we've actually found is that for our disaster drills and our disaster trainings, in particularly some of our mini drills, where we're walking into a department either on the university side or on the healthcare side, and we are working with a small group, typically anywhere between 15 to 100 people that we're training at one time, that community engagement is a really special tool. So we'd actually been conducting some of our Code Silver active shooter drills and trainings within our entities, and we do a briefing and then we do a simulation where we actually send a Confederate with a simulated handgun, and they're pursuing people within the facility and causing them to go down into their lockdown or their run, hide, fight protocol. And what was happening was that we do that only for about 10 minutes and then we call for debriefing. But some of the individuals who were part of the simulation had hidden themselves so thoroughly that even though we would go through the hallways with a bullhorn and say the drill's over, please meet at the debriefing room, they would stay locked down for the next 20 minutes, 30 minutes, and our debriefing room only had half the people that we were supposed to have for the debriefing. And that's because we told them, when you go into a lockdown mode or when you're in a barricaded mode, you don't come out for anything. And so they would hear things or they wouldn't hear things because they heard things so thoroughly that, you know, they had hidden so thoroughly that they didn't know that the drill was over. So we actually created a special subscription for this at the beginning of our disaster drill for them. They actually subscribe into a community engagement message, a notification, and we notify them when the drill has started, and then more importantly, we notify them when the drill has ended and when to return back. And our experience has been it makes it so much faster for us to conduct our drills now because we can get those people back out of their lockdown and barricaded mode, back into the conference room, because now they're receiving the all clear alert, just like they would in real life, that the scene is clear. And our final use case scenario under sort of the temporary event notification is helping to manage our media. So as a major tertiary care center and level 1 trauma center, we oftentimes have media that are showing up to cover a large event or some sort of newsworthy patient admission or event, such as, you know, December 2, we had a lot of news media. Anytime we have anything involving a hazardous materials event or something like that, a patient that's contaminated, we get a lot of news media showing up. And this will allow us to have our news media crews subscribe to this, and then we can inform them where our media briefings are going to occur and when they're going to occur. So that just helps us communicate with them in a way that allows us to relocate them to the right place at the right time. We actually originally anticipated using community engagement in a number of areas. Like I mentioned before, we're undergoing a major campus transformation project, and we're anticipating thousands of construction workers on our campus within the next 3 to 6 months here. And we had actually looked at using community engagement to notify our construction workers if we had an emergency or disaster on campus. But in working with our safety officers from our contractors, we discovered that they actually they don't allow their workers, their construction workers, to carry personal communication devices like a cell phone, because if they're up on the tower setting I-beams in place, they don't want them receiving phone calls or having to check their text messages when their undivided attention needs to be for the safety of the environment that they're working in. And so we've actually pulled back from that in terms of using community engagement for our construction workers, but rather we're actually enrolling those safety officers and foremen into our actual Everbridge system, and so they will be among the first to get the full messages that we're sending out as well. And then they have their own protocol and policy for notifying their construction workers, and that involves an air horn sound that goes off. There's a very large siren that they sound if there's an emergency or disaster. And also originally we were looking at utilizing this with our patients and visitors within the inpatient setting, but in talking with our clinicians, we recognized, or they brought to our attention, that they didn't want patients and visitors in the inpatient setting notified of disasters through the community engagement tool, primarily because when we look at sending out a notification, we typically will send out instructions on what we need you to do, and some background about what has happened, what we're doing, and then again, reiterating what we want them to do. And inpatients, because of their condition, don't have the ability to take those protective actions. And so it would simply increase the patient anxiety without allowing them to really have any useful information. So in this special case and situation, we actually are relying now on our clinical providers who get their notifications through Alertus, and for those managers and others and physicians who get their notifications through their personal devices, we'll be able then to communicate the specific protective actions that we want our patients to undertake. And then finally, students are also a non-use situation, and I'll explain that later in the return on investment slide.